Hi, Mark Jamin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. By now, you're probably aware there have been 4 additional positive cases reported in Haywood County in the past 3 days. Also, Jackson County has seen a spike from 5 to 24 cases in the past week. So I'm going to pause the series, What's the Risk of Reopening, for an important update, and we'll go back to that tomorrow. So here's what this data tells us. First, if you have doubted there was virus around, it's clear now that there is. Second, this reinforces the necessity of isolating yourself immediately if you start to get suggestive symptoms, and quarantine for a significant exposure. This is defined as contact with someone who has symptoms, within 6 feet, for longer than 30 minutes without any protective gear like a mask. And note the recommendation for this time frame changed this week from 10 to 30 minutes. In cases 1 through 5, these individuals isolated themselves when their symptoms developed, and because of that, they had very few contacts, all of whom could be traced, and none turned out to be positive. These infections were contained. However, with the cases this week, unfortunately, the same is not true. These individuals did not isolate themselves once they got sick, which makes tracking, tracing, and testing everyone with a significant exposure difficult and likely not possible. I think we have to assume others in the community have been exposed now too. What this means for the next few weeks is anyone's guess, but I think we can expect an increase in cases over at least the next 2 to 3 weeks, and longer if each of us do not do our part to tamp this down right now. If this changes anything, it should reinforce the commitment to follow the recommended public health measures: good hand washing, social distancing and avoiding crowds, wearing a mask, disinfecting frequently used surfaces, and not touching one's face. As the virus in the community increases, we need more of this to keep ahead of any illness. So what to do? Well, number 1, it's best to assume anyone could be infected, or a carrier, including you. Number 2, stay the course with what you have been doing. It's your best protection. And number 3, if you have not been following the measures, now is the time to get on board. The more of us who take these measures to heart, the better our chances to keep this at bay. And really, what's the alternative? A spike that goes higher, drags on longer, and shuts down the economy even further? That doesn't serve any of us well. So tomorrow, stay tuned as we get back to part 2 of the series, What's the Risk? Keep an eye out for that. Be well, stay emotionally connected, and physically distant.